I'm live right now. I believe you can hear me and hear me clearly. And if you are not hearing me, here's my face. You don't want to see my face? Fine. You don't want to see my face? Fine. You don't want to see my face? Fine. If it's 1 minute already, I go live. It's still going. No view, no phone, no like. But meanwhile, when you give up, it still continues to be. Which question you have to do for me? Regarding to diabetes, so will appear as journals. Okay. So I will be ready to answer all your questions if you have any to answer. Diabetes is one thing. Which question regarding diabetes for me today? I just want to know. You're free to ask your questions and I'll answer you. Okay, goes to my face, go to my page, subscribe, ask questions. We are here to help ourselves and solve the problem that we are facing health wise, medically. Okay, I'm relaxing right now. You can ask your questions. I will answer you. This is Shuaibu Health Talk. We are not much better than anyone else. Living a healthy life is compulsory. It's in your right. So you don't need to beg for it. You don't need to beg to live a healthy life. You need to live a healthy life by force. So when we come online, we discuss health, health, which diabetes, which question regarding to diabetes you have for me today. Okay. as much as possible going online, that will also that will tell YouTube that your channel isn't just top that done. It will send a message to YouTube that this channel is lively and those persons that is maintaining this channel are willing to go. Yes, if you want to see my face, this is my face, okay? Yep. So you can ask questions regarding to diabetes. I will answer you. I will answer you. Ask. I'm watching. I didn't see any question from any of you. If you are not interested in the video or the live, you can send it to other people. Does it kill? No. No, it doesn't kill. Okay? It doesn't kill, but if you did not manage it properly, it can kill you. Okay? As I think, Suzanne. If you have diabetics and you did not manage it properly, it can kill. But diabetes doesn't kill. Okay? And how can it kill you? Because diabetes cause organs damage. Is if one has diabetes, uncontrolled diabetes can lead to kidney failure. It can cause liver failure. It can cause spleen or other organs in the body can cause that is what we call nerve damage. That's why when somebody have diabetes that is not controlled, it lead to amputations. It destroy nerves, the legs in the nerves. It destroy it and lead to amputation sometimes. Okay? So if this is not addressed properly, it can lead to death. But diabetes itself cannot cause death. It only cause some problem which can lead to death. So I'm still live, waiting to answer your question. I see they live. Oh. The area is noisy, but it doesn't mean just bring your questions. I will answer you. There are two types of medications. That is oral medications that are often used for diabetes in Nigeria, which is metformin and glibenclamide. If you watch my videos, you will see it. I talk about metformin and glibenclamide. One of the significant effects of this metformin is that it lack or it reduce vitamin B12 in the body system. And when that happens, that's what leads to nerve damage. So often sometimes when you're taking metformin, you ought to make sure that there is you take supplement, vitamin B12 supplement. And if you're taking metformin is not working properly, combine it with glibenclamide. But I guess level where your glucose will get up to that you need to, you know, switch to insulin injections. Okay, maybe for example now, if your blood sugar is above 200, 300 milligram per deciliter, then definitely you got to use insulin injection to crash it down. While using the insulin injections, make sure that you monitor it. That's why I always advise people with diabetes to have these glucometer machines around them. Okay, when you take the insulin injections within some hours, you check it to see if they crash because if the sugar crash entirely, it can also kill. That's what we call hypoglycemia. If it is high, it's called hyperglycemia. If it is low, it's called hypoglycemia. All is not good for the body. So you got to be able to make sure that it is in the right proportion. Your blood sugar should be in the right proportion. One of the significant problem in diabetes is that is intermittent fluctuation going up and down. If your blood sugar go up, you bring it down, go up, you bring it down. It indirectly or silently damaging your organs. Silently damaging your organs, okay? Silently damaging your organ. It weakens what we call nephropathy. It weakens the kidney, sometimes destroy the liver, even the eye. That's tiny vein inside the eye that supply energies to the eye. When sugar stay high for too long, it kill that nerves. And when that nerves died, the person go blind and it is irreversible. So even at that junction, you start controlling your diabetes, the person will remain blind forever if that nerve is already damaged. So that's why leaving your blood sugar to keep going up and down is a serious problem. I see they watch you, I see they expect your question. It's only Akin Sugan that asked question and I've answered his question and I believe he's okay or she's okay with it. The Akim Suzanne asked question, please, what caused difficulties in breathing? Okay, there's a lot of cause of it. Okay, are you living in an environment that is moody? Have you heard about mood recently? Yes, if you heard about mood recently, it can cause difficulty in breathing. When somebody have asthma, it can cause difficulties in breathing. When somebody have pneumonia, it can cause difficulty in breathing. So there's a lot of things that cause difficulties in breathing. However, it depends on your age. Obesity sometimes can also cause difficulties in breathing. What I mean by obesity, if you fat, extra body, it can cause difficulties in breathing. There's a lot cause of difficulties in breathing. So if you're having difficulties in breathing, number one, what is your age? And what are the experience do you have before having difficulties in breathing? So I'm still waiting for your question, your answer. Like mouth opening when you're trying to breathe. Do you have a kata? If you're having kata, it can cause you sometimes. Maybe your nose is blocked. Okay? If your nose is blocked, then you can find it difficult to breathe. Sometimes what causes nose block is kata or some object. Okay. Don't open your mouth to breathe in the first place. You don't open your mouth to breathe in the first place, okay? Shouldn't open your mouth to breathe in the first place. Mouth is not even meant for breathing. It's just an alternative. And if, for example, something happened to your nose, you could not use your nose to breathe properly, then you use your mouth to support it, but nose is meant for breathing. So if anything, what leads that make you open your mouth to breathe? That's the most important. We need to answer the question before we know what to talk from there. Yeah, good morning. Okay, you're welcome. You got to be. So I'm still waiting for your question, questions, and question. By the work, I want to give patient result. Okay, I want to attend to patients. This is my office. We are here working days and nights to make sure that things go on fine. Okay, I've heard you. You're welcome. You are welcome. You have more question? Any more question? If you know the how are you? How are you, Adewumi Tajudin? Any question? On the first, why go- If you have question, I'm ready to answer you. We are ready to answer you. But let question revolve around the medical field, okay? 2652. What can cause stomach pain? Okay, many things can cause stomach pain. Do you have ulcer? How long have you dewormed yourself? The kind of food you use sometime at some point in time can also lead to stomach pain. However, it depends on your sex. Are you male or female? If you are male, if you are female, sometimes if you're having some, you know, sexually transmitted infections, it might not directly lead to stomach pain, just inside the womb, but it might feel like it's stomach pain. So number one, what? And also, if you have excess typhoid, it can also lead to stomach pain. So I did meet Judin. If you have excess typhoid, it can lead to stomach pains. As a man, if you're consistent, that's frequent stomach pain. Is it stooling? Are you stooling? Like the stooling is watery or somehow offensive. That's what we call dysentery sometimes. Your message is being held for review. Let me check whether is it offensive message. Why men complain stomach pain after sex? Okay, I've read the message. It said, why men do complain stomach pains during after sex? Okay. Anybody that complains of stomach pain after sex, the person is unhealthy. You need to see his or her doctor. The man need to see his doctor. He's not healthy. There's no connection between the stomach and sex. No, no connection between stomach and sex. Maybe the energy you put in place sometimes will lead to stomach pain, but not actually it's because of the sex, like having stomach pain. No, no connections between the stomach and the sex. So if you have sex, anytime you have sex, you start having stomach pain. Maybe the friction, the actions, the movement that lead to some, one or two things in your stomach. And that simply means that you're having problem before in your belly. So you got to see your health professional, you got to see your doctor. Adewumi Tajid, I hope that answer your question. So I'm back here. I am back. Oh. Who has more question to ask? Who has more question? Hmm? Nobody has more question. One of the major problem we are seeing these days, people are just dying. You see somebody today, tomorrow is gone. Have you ever asked yourself what is the cause of this problem? Have you ever asked yourself the simple question, what is the cause of this problem? You see somebody today, tomorrow is no more. The person that is healthy, nothing is happening to him, you don't have any problem, no stomach pain, no headache, nothing. You just collapse and die. Have you asked yourself those questions? Those are the things we need to put in place. See, there's a major problem we always try to avoid that we end up becoming a victim. When somebody suddenly dies in your family, okay, you need to know the cause of his or her death. You need to know the cause of his or her death because there are what we call genetic transmutation. So if, for example, now your father is diabetic or your mother is diabetic or one of your relatives is diabetic, definitely you are going to be diabetic in the future. So you got to know the cause of the death of your someone related to you that you're related close to you. Know them so that you know when you get the histories of your lineage, then you know how to maintain your own life. Heart attack. You can simply prevent heart attack by regular exercise. See, as a human being, there are two things that are important to your life: your health and your wealth. And what should come first in your life endeavor is your health and your wealth. Okay, your health and your wealth. Because if you are not healthy, you can't go out for money. Even you have made the money and you are not healthy, you're going to spend all the money to regain back your health, and they end up losing the life that you are trying to gain back, and you lose the money. So take your health as your priority. Like I always said, if you are 40 years and above, be you male or female, try as much as possible to be checking these three things. go to laboratory. You must not fall sick before you go to laboratory for an investigation. Maybe, for example, you go to laboratory to check. No, some people says I don't go to lab. I don't go to lab. If you are above 40 years, make sure your sugar level. Check your sugar level frequently. Secondly, BP, high blood pressure is very very important. And lastly, urinalysis. I will explain why urinalysis is important here. Okay, I'll explain why urinalysis is important. The importance of urinalysis is to investigate early kidney problem or liver problem. If you go for urinalysis and they find out that you have uh, bilirubin on your urine, excess bilirubin, that is an indication of liver problem. In urinalysis, if you have protein, excess protein as a man, that's an indication of kidney problems or sexually transmitted infections. In urinalysis, if you have sugar, this leakage of sugars in your urine, they find out that you have sugar. That is an indication that you have diabetes. What if it is blood? When you have blood in your urine, that is an indication that you might be having kidney problem. So these three tests are very important as human being, most especially if you have crossed 40 years and above. Just be able to make sure that you go to laboratory, you do fasting blood sugar, urinalysis, and make sure your BP is often checked regularly. So you're good to go. Who is going to connect with me again? I'm still waiting for people to connect with me because I want to dish out, answer question, respond to answer a question, and possibly ask a question. You can be joining me every day, morning, evening, for health talk. What question regarding your diabetes you have for me today? Okay, I think I've tried today. I'll be going off now on offline. I'll be ending the live discussion. I only have two top fans, Akin and Adewomi. Thank you for joining me on today's live.